Hey, it's Debbie Potts, and I am having Dr. Matt Dawson on the podcast today to talk about precision medicine, wild health medicine, the Clarity Report, and more, as I am so into personalizing your program, looking at genetics, looking at functional lab testing, and helping putting together a program for a client to live their best life. So, precision medicine program will go into what that is and the Clarity Report. I just wanted to share a little bit before we start with Matt on my report. So, I got my precision medicine wild health clarity report, and what they do is look at blood chemistry and genetics, and then sometimes we need to add in more different labs, but we'll do this as separate video, but just give you a little heads up. Pretty cool. Diet, nutrition, looking at macronutrients based on my genetics and my SNPs. And then we look at fat intolerance, carb intolerance, saturated fat intolerance. It gives you a little dial, green, optimal, orange is darker color is a little more less optimal. So we'll go into this. If you're interested, I'll do a full episode on my report. And then what I think is interesting, looking at my APOE status, for example, carb-related labs, A1C, glucose, insulin resistance, IR, triglycerides, HDL ratio, lipid panel. And I want to bring this up today on lipid panel because we've talked a lot and read a lot and heard a lot about total cholesterol isn't what we should be afraid of for heart disease. So looking at the different types of markers doesn't show here, but the LDL particle size and ApoB. So I want to bring that up because obviously my cholesterol has gone up and my HDL, LDLs, those look a little higher LDL, but why? What drives that up? And then macronutrient recommendations based on my genetic SNPs. So that's good information to work with a health coach to figure out what to do with that. So metabolism, my methylation cycle, go into this whole complicated MTHFR, dietary folate, protein, methionine, all this information. What does that mean? So this is a good reason too that, okay, I think I'm doing all the right things, but I'm having some red flags here. So my homocysteine, I want below 8, under 7. So looking at this, that, oh, I need some more folate. So this methylation status, as we went into briefly looking at how this works, vitamin B6, B2, B12, this is actually another reason why I never know why doctors just, my mom keeps getting B12. It's like, what about all the other Bs? They're getting left out. B12 isn't the only thing. So we need to look at this whole picture. So B12 and folate are on here, looking at correlating labs together, choline related labs, AST and ALT. What does that mean? And more. So I do this looking at all these interesting markers, right? And I'll be using this with clients, but super fascinating information. Metabolism and vitamins. This is just a generic report that genetic variations, omega-3s, the role of vitamin D, vitamin A, B12, E. So good stuff. So let's bring on Matt Dawson to talk about the history, the story, the mission, and his purpose. So I am going to stop sharing my screen and bring him on. All right, I have the Dr. Matthew Dawson on my podcast to talk about how we can improve the aging process, as I keep talking about how we can live our best lives, the second half of our life, how we can thrive and not struggle as we age. And just because we're athletes now doesn't mean we're fit and healthy from the inside out. So I've got Dr. Dawson to explain how we can live our best lives. So thanks.
Thanks, Debbie. I'm excited to be with you.
Now, you are involved in wild health, precision medicine, And I wanted to start with the why. I always like to know, why do we start this program? Why do you do what you do? Tell us a little bit about your passion, purpose, and mission.
Sure. Yeah. So I was a physician in traditional medicine before, and I really enjoyed it. I went into emergency medicine as a specialty, and it's exciting. It's fun, like saving someone's life. That's very rewarding. At the same time, I just kept seeing the same things come in over and over, even the same individuals come in over and over. And I just realized with the traditional medicine in general, it wasn't helping people. We were putting band-aids on things. We weren't getting to the root cause. It reminded me of a story that I heard, a kind of parable about a village on a river. And one day someone was floating by screaming for help. They all ran out and pulled the person out. Um, Saved their life. The next day, the same thing happened. They went and saved this other person. On the third day, someone finally said, maybe we should go upstream and see who's throwing people in. And that's how I felt like in the emergency department. I was saving these people, pulling them out, but I really had a drive to go further upstream and try to help people optimize and prevent these horrible diseases that I was seeing.
Keywords: optimize and prevent. Yeah. Well, I think I wish more doctors would be starting to think outside the box. Like, why do we keep this happening, see this happening? And it's great to see more and more people from traditional medicine to go step out of that. And I think it's starting to occur more. Do you think you've seen other doctors starting to look at things a little differently as yourself?
For sure. The difficulty is the incentive model. Like physicians and hospitals get paid to take care of these really sick patients, and they don't get paid to prevent and optimize. So that's been the barrier. In my experience, almost every physician wants to take good care of people and make a big difference. It's just the incentive model itself. It's really difficult to do that and make it work. So you have to have a motivated individual as well as the provider. And we've found lots of motivated people as well. And when you match that up, the motivated person with the motivated provider to optimize and prevent, that's where you really find the magic.
Yeah. So do doctors get incentivized, money get paid if they do more pharmaceutical drugs? They get paid bonus for certain things?
No, not for pharmaceutical drugs per se. I mean, in the past, there were some bad situations. I think that's been corrected in medicine in general. What I meant by that, though, is that for us, when we see a patient, we do an incredible amount. We sequence their DNA, we do all the blood testing, microbiome data, looking at the wearable data. All of these things spend a lot of time with the patient, and insurance doesn't pay for those things unless you have a disease and a diagnosis. Most medical providers don't get paid to take care of that individual. So what happens is people don't come in early. There's no preventative part. There's no optimization. Insurance doesn't pay for sequencing someone's DNA, although it's critical. Like, how do you take care of someone without knowing their operating system, like their
Mhm.
genome, like what they're at risk for? So just what providers get paid for, which is to put band-aids on things and treat these diagnoses. That's what insurance pays for. And insurance will pay for $100,000 a year for dialysis treatment, but they won't pay a couple $1,000s per year to prevent the kidney disease that gets them in that situation.
Mhm. Well, that's kind of part of my motivation lately is my dad passed away 2 years ago, and I saw what happened, and then you're in the hospital setting, and it's incredible how that just kinda changes your mindset. Even though I've been in kind of the root cause medicine, functional medicine, health optimization space for 10, 15 years, but it's when you see your family members age and you see how they are treated by their doctors and the solutions that are given, it's very frustrating, but it's also empowering to me to do more of what I do and focus more on how we can improve the aging process because you just said kidney dialysis. We had a kidney doctor saying you need dialysis until you die, and it probably will kill you doing it, is what the guy told him. Had bedside manners. And then heart disease doctor, and then cancer type of doctor. And none of them are talking. They're just giving more medications, not finding the root cause and helping to prevent it. Instead, the only option you have is kidney dialysis. So, yeah, that's a big topic. And I'm sure a lot of people relate that, especially our audience, are endurance athletes, high performers. They're pushing themselves probably a little too much, and they're fit, but inactive, but they're not might be not healthy from the inside out so much because of what we're doing. So
Mhm.
I feel the need to share here's what we can do to improve a whole you from the inside out. I really love what you guys have done over the years at Wild Health Precision Medicine. Tell us a little bit what it is all about if people are not familiar with it.
Yeah, well, that's a great. Yeah, I'm sorry to hear about your family member in that situation. That's one of the issues with modern medicine is we treat people like a collection of organ systems. You got a heart doctor and a kidney doctor and all this, and we're not. We're individual. We're whole people. So that's the approach that we take. And part of my inspiration was a family member as well. So Mike Mallon and I co-founded Wild Health. When we decided we wanted to go upstream, excuse me, we also saw a lot of emerging evidence around genomics and precision medicine. And finally, it looked like, based on the science, that we could finally do personalized medicine for the first time, really tailor a diet and exercise program and sleep according to someone's DNA in a real precision way. So we started doing this for ourselves, family members, friends who also trusted us when we first started. And my grandmother was one of the first patients that we took care of. And she had been diagnosed with dementia, with Alzheimer's disease. And when we saw her, instead of the all the different heart doctor, kidney doctor, liver doctor, brain neurologist, the brain doctor, all these different, we treated her as a whole person. We sequenced her DNA, looked at all the advantages, disadvantages she has. That's her kind of human operating system. But that's only 20% of your outcome. The other 80% is epigenetics, what you do,
Mm.
the things you're talking about, what you eat, how you sleep, your stress levels, what you're exposed to. So we also did a really big panel of blood work, looking at all the factors that make you feel and perform a certain way now. We also looked at wearable data, like I mentioned, microbiome data, and we take all of that, and then we were able to come up with what is the perfect diet for her. Not the perfect diet for most people, but for her. How are we going to get her exercising the best? All of these things. And when we saw her back, initially she had a MoCA score, a Montreal Cognitive Assessment of 16, which is moderate dementia. And with dementia, you just want people to slowly decline, go 16, 15, 14, not go 16, 10, 5. And when we saw her, she actually had an improvement, a 25% improvement from a MoCA of 16 to 20, which we didn't talk about back then because people wouldn't believe you because it's just not what happened in medicine. And then immediately after that, we saw my mother because I was worried she'd have the genetics like my grandmother did. And sure enough, she had an ApoE4 gene that made her 2 to 3 times increased risk. We put her on the same program. Within 3 months, she lost 40 pounds, said she felt 20 years younger. We put Mike's mom on the program. She lost 80 pounds, got off all of her medications. And those personal experiences are what made us then decide to go all the way in and do this precision medicine. So that's what it is. It's taking that holistic approach, a really deep dive into the data, the DNA, epigenetics. We also do DNA methylation testing related to their epigenetics. We look at about 1 million sites on someone's genome to see how much every gene is turned up and down, as well to look at things like biologic age and age pace and things like that. So that's what precision medicine is, getting an incredible amount of data that can come up with precise recommendations for someone to optimize and prevent.
Mhm. So if someone starts the program, is they get blood chemistry panel and a genetic test? Tell us a little bit how the program operates.
Yeah, so everyone that comes in, and we have, again, my mother and my grandmother, but we also have a lot of pro athletes, Olympic athletes, NBA players, NFL players. Regardless of who you are, we start the same way.
Mm.
We DNA, signature DNA, again, that's 20% of the outcome. We do the epigenetics, like I mentioned. We use a company called True Diagnostic that has really incredible epigenetic testing. We do blood work, a big panel of biomarkers, and then sometimes microbiome, sometimes a lot of other tests, depending on what the person needs. But everyone gets the DNA, the epigenetics, and the blood work to start. And from that, we've developed a platform, an AI-driven platform. We've spent an incredible tens of millions of dollars on this platform to be able to take those millions of data points and make the recommendations. And then everyone gets a doctor and a health coach. So they have unlimited health coaching with the health coach and the physicians, 4 visits a year. And so you have someone then walking with you through the process and helping you actually put the recommendations in place and get the results.
How do you feel that this program is sets apart from all the different options out there? It seems to be a growing area, but you guys have been around a little bit longer. What do you find that makes you unique and effective?
Yeah, I think there's a lot of places where you can get your DNA tested. We think DNA by itself is almost worthless because, again, just like you're not a collection of organ systems. You're not just your DNA either. Your DNA is not your destiny. So we also need the blood work. We need the epigenetics. And also we use a technique that was kind of lost to modern medicine. We found some ancient textbooks and it talked about this thing called talking to your patient. So we also have a relationship and ask questions about things that we can't measure in the blood work, like not only what do you eat, but who do you eat with? When do you eat? Like, what are your emotional needs? What are your spiritual beliefs? All of these things go into making a person. So we take a really deep science approach, but then also a very humanistic approach too, with the health coach and doctor and that relationship. We help people work through the issues of maybe why they're not putting the recommendations into place. What emotional barriers do they have that as well? So I think we take a I don't know if anyone takes as deep of a science and kind of a humanistic holistic approach as we do as well, because we just can't untwine the two. We think the two are so importantly linked together.
Well, I agree with that for sure. But it's interesting. I bought metabolic testing portable kit to do fitness testing, which I'm doing a seminar for our Wild Health Precision Medicine group next Thursday. And how
Awesome.
this information is so helpful that you get your resting metabolism, a report with all this information and the exercise test. Here's a report. But to me, it means nothing, same as a report, if you don't have a coach to work with. What are you doing now? What's not working? What's working? What could you do? What are you interested in doing? And it's the same kind of thing. I think so many people get these reports and it just goes into a file or pile of paper that is not actionable items. That how are you going to implement some of these strategies to create effective change to get to your goals, whatever setting your goals? What do you want out of this? Or else it's just more money people throw away on biohacking
Mhm.
events.
Yeah. And
Yeah.
even in the recommendations, while gathering all this data, we're able to make more precision recommendations. It's more guided and precise. It's still precision medicine. It's not perfect medicine. So people are so complex. Having the health coach and the doctor follow along is critically important because we may make all of these recommendations based on the data, but then we want objective markers of are we having success or not? If our goal is to increase your VO2 max, sure, we'll give you a plan to do that, but then let's retest your VO2 max and see if we're making progress or not. So I think the longitudinal component of it is really important too, not to just get the report, like you said, and then let someone figure it out on their own.
Well, yeah, great question there is when should you retest? Get all this information. Do you need to do genetics again or just get your blood chemistry every 3 months? What do you suggest for retesting and follow up course correction?
Yeah. So it totally depends on the test, like you just kind of alluded to, and the goals of the person. So what I mean by that is, yeah, we'll never test, we'll never test your genetics again. They don't change. However, your epigenetics, how you're expressing those genes is changing constantly. So the true diagnostic test, for example, that we look at, the reason why I love that test is because I don't really care that much about biologic age tests. To me, if you're chronologically 40, if you're biologically 44, 36, I'm gonna try to optimize you either way. But what I really like about true diagnostics reports are this pace. It's a test developed by Duke that they put out that tells your pace of aging. And what I like about it is it's very sensitive to change, to intervention. So if someone has a hip surgery or gets in a car accident or gets pregnant, their pregnancy increases rate of aging by 20%, or get COVID, it increases when they get better or they have the baby, your rate of aging comes back down. So what this allows us to do is do these N of one experiments to say, okay, if we want to change your diet or try this new supplement or do this certain thing, we're going to do that. But then we're going to recheck that pace of aging test in 3 to 6 months to see are we having the effect that we want. And the reason why aging and pace of aging is important is age is the number one risk factor for every other chronic disease. So if I could have one metric, it would be that pace of aging to globally see how you're doing. The other tests, how often we repeat those, it depends. If it's a CRP and inflammation, that's a very acute phase thing. Like we could retest that in a week after making a change, reducing your gluten or dairy or something like that, retest it. Or if it's something like hemoglobin A1C or omega-3 index, if those are off, those take a few months to really change. So it totally depends on the metric and the go and what we're after. It's VO2 max, like you mentioned, probably going to be 6 months of training before we really test that again, just because if it takes a little while, unless you're brand new. But if you're already a pretty trained athlete, it takes a while to have an impact there.
Hmm. Yeah, and the other side of it too is you mentioned inflammation. I think chronic inflammation is a big area we should be aware of, especially for athletes. So I know you guys seem to work with a lot of CrossFit athletes and professional athletes, endurance athletes. What do you find with athletes how they need to be a little bit aware of what they're doing might be breaking themselves down a little bit, be more anabolic versus catabolic and increasing aging process, perhaps? Any red flags people need to look for?
Yeah, with athletes, it's interesting. I'll give you a couple examples that I think are illustrative. An athlete is a whole person just like everyone else. So we had an NBA player. He was a max contract guy. He came just not that long ago, and he actually came initially because his agent brought him because of mood issues throughout the season. He's really struggling with kind of some low level depression, anxiety. And obviously, instead of we're not going to jump to SSRIs or medications, we want to treat this, look at the whole picture, and found some really interesting things with his DNA and his lifestyle. So what he was doing was the same thing as the rest of his teammates. He would drink a bunch of Red Bull and caffeine and other drinks right before a game, because we've known for decades that caffeine is an ergogenic aid. It makes you perform better. But in those studies where it shows caffeine as an ergogenic aid, it's actually an ergogenic aid. It makes you perform better for about 80% of people. So not everyone. So when you break that down by how fast, you're a fast or slow caffeine metabolizer, it makes the fast metabolizers perform better. It actually hurts the performance of the slow metabolizers. There's really good studies on 10K time trials and cycling and other athletics as well. Well, it turns out he's a slow metabolizer. So he's hurting himself by doing this. He also has a SNP, an Adora 2A polymorphism in his DNA that makes caffeine have more of a negative effect on his sleep. So the combination of that slow metabolizing, hurting his performance in a game, and then hurting his sleep meant that he was not getting to sleep till 3 or 4 in the morning, getting up just in time for shoot around, this vicious cycle that he was in that was leading to this lower performance and this mood issues. And we just then fixed his lifestyle to his genetics, and he excelled. He had an incredible year. Was in talks to win MVP that year. This was actually a couple of years ago, and it's again taking that whole person into account is critically important. You mentioned chronic inflammation too, so I'll tell you anecdotally one thing that we've seen. I think the literature backs this up as well. With athletes, we think of their performance and just kind of in the season and go, go, go. That does lead to a lot of chronic inflammation. One of the things that we've noted, and pretty much everyone that's over 40 will do a cardiac CT scan of their heart called a Clearly scan. It's an AI scan to look at their blood vessels. And we find a lot of calcium deposits and a lot of these real kind of issues that are going to lead to heart attack and stroke and other things in the future because of that extreme kind of low level chronic inflammation always ongoing from these athletes and not taking the time and not eating a proper diet. Like we know with athletes, there's kind of a saying, like if the furnace is hot enough, you can burn anything. And I think a lot of athletes think they can just consume anything and everything. And they kind of can to a certain degree, and it doesn't necessarily kill their performance, but it's really setting them up for negative issues in the future. And it probably is hurting their performance as well. So with our athletes, we really try to help them think about themselves 30 and 40 years from now, not just their performance over the next season.
Yeah, that's exactly what I've been trying to say is like, what are you doing now? So when you're 70, 80, 90 years old, 100 years old, because I think especially my background is Ironman triathlons and marathons, a 50K run. And my personal mission started 2013 when I got adrenal exhaustion. And I wondered, okay, why do I get this burnout and breakdown? And other friends are doing multiple Ironmans a year. We do Ironman World Championship, and I'm the one getting busted and they get away with it. It's like, what? So that's kind of led me into genetics. Like, okay, how can I not tolerate that load that other people can? And I think it's so important to look at what are you doing now to improve yourself later, not just focusing on your race. Because I think looking at blood chemistry panels and reading about leaky gut for a lot of athletes is an interesting area to go into. Like, okay, is your workout actually causing gut issues? And is that leaky gut? As I was diving in rabbit hole of Dr. Fasano's research of all disease starts with a leaky gut and how that can impact an athlete's performance in life and sports.
Yeah. Yeah. It's interesting. So when Mike and I first got into this and first started looking at our DNA, I was doing Ironman racing at that time as well. I'd not competitively. I was too slow for it to even count. It shouldn't have counted. I was so slow, but I'd
Doesn't matter.
done a 50-mile race and some other ultras like you had mentioned. And it was a real aha moment for me looking at my DNA for a couple reasons related to kind of athletics. One, I noticed that I had a couple SNPs, right, ACTN and a couple others that made me need a little more recovery than other people. And at the time, I couldn't put my socks on in the morning without sitting
Mm.
down, just of how much inflammation and back pain and things and stiffness. And I also noticed I'd had a lot of ligament and tendon injuries. And I also noticed I had a collagen 5A1 SNP that meant I needed more collagen protein. And so when I made those two changes, get more recovery and more collagen protein, bone broth, sardines, those kind of things, my performance really went up, and I just felt so much better. And I just realized, yeah, I can't, just like you, not doing the exact same thing as everyone else. I couldn't. I needed to do it differently than what a standard training program or standard diet would be for an endurance athlete, because everyone's so different. And one thing that I noted from what you were saying is, why did I get it and these other people not get it? I think it's interesting though too. A lot of times, I don't think people don't usually post like about their adrenal fatigue on their Instagram stories and stuff. So you never know like what other people are struggling with. We know ours, but not other people. So I think it's probably more common, at least in my experience, than a lot of people think, for endurance athletes. I ended up stopping the long distance endurance stuff because I just decided it was causing more problems for me long term. That I loved it, but my love and passion for it, I found I could put somewhere else. And yeah, long term, for me at least, it ended up not being something that I wanted to do forever.
Yeah, I mean that's a Ben Greenfield's a good example of that. If you've known him for a long time, that you see Ben was big into, well, early on bodybuilding, but he was big into Ironman type of long distance triathlons, then switched to Spartan races and those type of obstacle races. And then he realized he's doing more damage than good, and now he is into more strength training and, other recovery methods and hot, cold, and all that, different strategies and time in nature and walking. And so it's really interesting to watch him as an example of going, okay, my body doesn't do well at this. I'm actually causing more damage, and let's reverse and re-engineer everything and figure out what to do to be my best self so I can be best father and husband and family members. So I think it's good to individualize all this information.
Yeah, yeah, for sure. I just saw Ben a few days ago. We were together at a conference in LA, and yeah, we're similar age, and I think we've been on a similar trajectory of hard charging forever, and then no, maybe family and and slowing down a little bit is important as well.
Yeah. So with that, I know, looking at biometrics, you were talking about measuring. What type of devices do you guys like to have clients use to help coach them better?
Yeah, so we're pretty device agnostic because we feel like we can get information from just about anything. Our patients and clients a lot of times wear Whoop or Ring, Apple Watch, any of those. The way we've built our technology is to be able to ingest kind of anything that Apple Health and Google Health pull in to as well. So that's pretty much any device. So we like all of those. We do, if there's one thing we can really measure and get data on, it comes from a wearable standpoint, it's something around sleep, to really optimize and quantify sleep, and then also kind of HRV and recovery the morning after. The fact that pretty much everything does that, whether we're talking about the Aura, Whoop, or Apple Watch, means that we can be pretty agnostic. We used to have clear preferences around which one, but they've all gotten quite a bit better. Like it used to, I really liked the Aura for sleep and wasn't happy with Apple Watch and Whoop's sleep data, but now they're actually pretty good. They're all pretty good. Other things like CGMs, continuous glucose monitors, we use those quite a bit with patients as well. But I think those are the big ones that we like to use.
Do you find them as accurate though? If I mean, you're not wearing a chest strap, so when you are doing, I mean, I use Aura. I think it also comes down to I have a Garmin, but I'm not going to wear this to bed. I don't want to Whoop, wristbands. I always find that with clients is, okay, what do you feel comfortable? I have some people that don't like either. So, but wearing a chest strap seems to be the most accurate data when you are testing someone's actual heart rate variability. If you can't go to lab and get electrodes to your head, but what do you think for sleep, deep sleep and REM and heart rate variability? Do you think that they're pretty accurate or just consistent because they're all reading it with the red light back of your wrist or ring?
Yeah, so you're certainly going to get a more accurate HRV measurement with a chest strap, but I find them to be good enough directionally. And the exact number that someone gets isn't as important to me as it is like they're using a consistent device to measure it over time so we can see the kind of directionality.
Mhm.
I think that's it's ease of use and what someone is going to do every day is a little more important to me than getting the number exactly right. So because of
Mhm.
that, and yeah, you have someone wear an Aura and a Whoop and an Apple Watch all the same night, you're going to get different measurements because they also use different algorithms to calculate it as well. So
Mhm.
it is important to stay with the same one once you find a form factor that you like. I preferred
Yeah.
the Aura Ring in the past, just like you said, at sleep, it seemed easier to sleep. But now I'm using an Apple Watch more just because we're
Mm.
some technologies that we're creating that has to do with the Apple Watch, and I actually sleep with it fine. I didn't
Mm.
think I would after a night or two. I got used to
Yeah.
it.
I'm laughing because I'm thinking some people do all of the above, right? So we're reaching those high performers that are overachievers that they'll go to bed with Whoop, Garmin and Apple and Aura, and then because I'll get them all my training peaks and like, okay, do we really need all that data? So what is the right
Yeah.
amount for someone to get the data baseline?
Yeah. Well, it's
Funny.
funny. I wonder if they're just doing that so they can pick the one that they like the best from the morning, which measurement they like the best too.
Have you been using heart rate variability at all to correlate with gut health and inflammation in the body? Do you ever get into that science side of it? Doing that?
Well, I think it's a great overall marker. And because we probably don't have perfect markers for gut inflammation per se, especially in a wearable manner, it probably is a good surrogate. I don't know the research that you're talking about, but yeah,
Mm.
but I certainly have seen how certain foods and things that normally would lead to inflammation problems certainly
Mhm.
decrease HRV and recovery scores. So I could see how there could be a connection there. But if there's some specific data and studies that you're referring, I don't actually, I'm not super familiar with those.
I don't know specific. I've just started diving into that, listening to people talk about the gut brain connection. And I was researching myself, like, okay, is there some way we can use that data of people that I see that have more gut inflammation, inflammatory bowel disease, or something, if their heart rate variability is consistently pretty low, and what to increase it, if you're trying all the lifestyle habits as just another rabbit hole, can we connect the dots here and put the quality of your microbiome status, health status in there with heart rate variability of the connection of the vagal nerve. It's just
Yeah.
fascinating. Different rabbit hole.
Yeah, well, I think the fact that HRV is a good integrator of so many other things and gut inflammation affects so many things, I think it could be an interesting surrogate. I just haven't seen that studied, and I'm not sure how you design the study exactly, but I think it's an interesting concept that you're onto something there.
I get down these rabbit holes lately. It's like, wait, what? Because I was, looking at everyone's data and as a health coach and practitioner. So, okay. So I have a question on lipids and looking at cardiovascular health. Dr. Peta Attia obviously is making a big influence in the world as Huberman and Dr. Rhonda Patrick, and really looking at what should we be testing for, say, lipids and other markers that we want to look at for cardiovascular health, maybe some red flags and being preventative side. So does precision medicine, your program, look at that area of health? And you can pull up my report too if you want an example.
Sure. So when it comes to lipids in general, so it's probably important to take a step back of why do we care?
Yeah.
We cares because it is fairly well associated with cardiovascular disease and risk, stroke, dementia, things like that. The quote unquote bad cholesterol that people talk about, like so your LDLP or your ApoB, LP little a, the more of those you have floating around in your bloodstream, the higher risk you are for cardiovascular disease. Now, that doesn't mean that you have to take those to zero and really crush those down because to have cardiovascular disease, to have one of these events, you need a few things happening. You need inflammation going around. You need those cholesterol particles. You need endothelial dysfunction and damage. You got to have all three of those. So I have patients. I have one lady. She's in her late 60s. LP little a through the roof, and it has been since we've been seeing her. Yet when we do her clearly scan, she's got no plaque, a perfect scan. And that's because she does so well with her diet and she runs 4 miles a day. She's really great with the lifestyle things. So she can tolerate those higher bad cholesterol markers, the LP little a, the ApoB, and those things. Whereas we have other people who have tons of inflammation, horrible diet, all these other factors, and their cholesterol is not through the roof, and they have plaque buildup. So by itself, it's not definitely going to lead to bad outcomes. However, those ApoB, Lp(a), the lower we get those, the lower we know your overall chances are. So the way that we approach this is look at those metrics. If they're optimal, if you have a really low ApoB, for example, great, we're good. If it's elevated, then we think, what are we going to do about it? We then see what are your other risk factors. We do a clearly scan, for example. Perfect scan, maybe we just watch it and we try lifestyle and diet interventions to try to bring it down over time slowly. Or if you have significant disease already, we know, okay, this is not only could cause a problem, it is causing a problem. So we need to do something about it. So we may try intensive lifestyle interventions, or we may go to medications. Like, we're not afraid to do that if we need to. We're usually stopping more medications than we're starting, but if we need to start one, we will. And that's where the genomics come in. We can run specific tests to look at which medications may be better for you. Mike, when we first started doing this, this was one of the big aha moments for us as well. He had cholesterol kind of through the roof, really elevated cholesterol. And this was before we had sequenced his DNA. His doctor put him on a statin. We were worried that he would have muscle breakdown and myopathy from it. Sure enough, he did. He didn't tolerate it. Really bad side effects. And then when we looked at his DNA, he had a SNP that almost guaranteed him to have that muscle breakdown and myopathy. And if we had known that before, we could have prevented that, and he could have tried a different intervention. So now ahead of time, if we're going to do an intervention for someone, we take a look and see what medication are they going to respond to the best.
Yeah, I think that's important. Because I think it's looking at the whole panel and looking at CRP, correct, and the cholesterol, but there's a lot of information as APOB out there. And so looking at the different markers in your genetics, I think is what a lot of people are not getting done. There's still, I have clients, personal training clients I've known forever that see this top doctor, but they're still looking at just cholesterol. Your cholesterol is high and not looking at the different specific markers as today's kind of modern medicine is looking at more preventative
Yeah.
LDL.
Yeah. And I kind of skipped over that because it feels like, yeah, it's crazy to me that anyone is still just getting a total cholesterol number and an HDL and an LDL. Like, so yeah, if people are still getting that and your doctor's just measuring those measurements, I would say probably go see someone else, see someone else. I skipped over assuming that everybody knows at this point that, yeah, it's these other
No.
ones that are more important, the Lp(a), the ApoB, and those. To do an NMR lipid panel is, I think, pretty necessary at this point, and
Mhm.
it's a big red flag if you're not getting that from your physician.
But I see it all the time. I have clients that see specific, VIP concierge level doctors. And I have people that actually went to the Mayo Clinic to do their executive program. And I was stunned that their markers were so old school. Okay, you're spending a ton of money seeing these specialists that are supposed to help you with longevity, but they're not testing any of these modern day markers that we have science to back it up. It's crazy.
Yeah, and it's scary too because it just points to me like, what else is this provider doing that is 10 to 20 years behind as well? So yeah, you definitely
Yeah.
need a good panel to get a good
Yeah.
idea of what to.
So I know we have short on time today, but can we look at I want to share my report real quick. For example, I was showing at the beginning of the show. I think it's just a good example.
Yeah,
That I
yeah,
just think this is the powerful part of the report is how we look at how you guys look at my personalized report, and you had me do blood work, and then we did the genetics, and then we're doing the true diagnostic age. I talked to them tomorrow, actually,
mm,
so we'll do a follow up with them. But with this, I think it's such a good information that they work with the doctor and the health coach to see, because I've done different tests and I know personally I can tell I don't tolerate a lot of carbohydrates, but the saturated fat I think is good information. I know this way learned from Ben Greenfield when he did the program years ago, started talking about this, that not everyone, when people get into doing low carb and higher fat and they're, figuring out their tolerance and they can't digest it properly. Can you give us any tips on here where we need to look at and why this is so important to look at these markers?
Yeah, for sure. And it's very rare that it's just one gene that has an effect or an outcome that we need to worry about and do something. So what you see here is these are called polygenic risk scores. So we look at a lot of different genes to then determine how you're going to process and if you have certain intolerances around saturated fats or carbs. And you're kind of right in the middle everywhere, which is nice. So what I see from that then is then we can talk about your specific goals and your lab markers as well. So with your saturated fat intolerance being kind of right there in the middle, then we can look down and see carb and lipid related. So like carbs, you didn't have like a ton of specific carb sensitivities, but your A1C is 5.7. So we could certainly make that, push that a little lower if you're not in a dangerous area, but over time, having that lower and having better insulin sensitivity would be great. So we probably would talk about refined carbohydrates and reducing those. And then with your lipid panel, you're just seeing the big ones here further down in
Mm.
blood work, see ApoB and LP-A and things like that. But I'm assuming with your LDL where it is, when we looked at ApoB and LP-A, there probably would be some room for lowering those. So we may talk about different types of fats as well. So we put this, we want the genetics and the lab work to kind of be together there so that we can make these complex decisions. We never make decisions just based on labs or just based on blood work. And then we get more specific as well, not only about kind of food categories, but are there certain kryptonite foods? Are there certain
Mm.
superfoods? So for me, and I'm not sure what yours are because I hadn't seen your
Yeah.
report before, but for me, I have an SH2B3. So it means wheat and gluten is one of my kryptonite.
Mm. Which
Uh,
report is that? I know I have that too. I'll
yeah, right
scroll
there.
down.
I
So,
saw it. You just scrolled over it. So you up at the very top of no, go a little higher. Yeah, so your SHB23 is in the box right below that. Down a little more. Down a little more. The box that's got kind of the written
oh, that
stuff.
one.
There you go. So you have two
Yeah.
risk alleles for SHB2B3. So that means you may not have celiac disease, but you are going to have a little more inflammation from wheat and gluten. So we would probably stay away from that as much as possible. Just below that, I see that you're a fast caffeine metabolizer. So we talked about earlier, caffeine, whether it's going to hurt or help your athletic performance, it probably will help yours because of that fast metabolizing. And so we get very specific about things like wheat and gluten,
Hmm.
caffeine. You may have an MCM6 polymorphism related to dairy that makes that more inflammatory for you as well. So we get
Hmm.
specific. I'm looking right now. There you go. I can see your collagen 5A1, which looks good. So different than me, you probably don't need a lot more collagen protein like I do. And I'm looking at this list here of specific SNPs, and looks like you probably have one risk allele for BCMO1, so you may need a little more vitamin A, for example. Uh,
Hmm.
and then it looks like you may have a FADS2 polymorphism, so you need more active form of the omega-3, so
Hmm.
more fish or potentially fish oil, again, depending on what your omega-3 level is. So
Hmm.
it's what is your genetics for it, and then what is the actual blood level? Because I have a FADS2 polymorphism, but I don't take any fish oil supplement because I eat, the only thing I've had today so far is 2 cans of sardines to eat. Like I
Hmm.
eat an incredible amount of sardines. So I eat so much of it in my food that I don't need the supplement. So we don't jump straight to a supplement based on genetics either. It's what do you eat and what's your blood work. It all kind of flows together to
Yeah.
help patients.
What do you find with the athletes? So I was looking this up too. My other rabbit hole lately was oxidative stress on the athlete when they're doing excessive training, overtraining under recovery. They're doing the long distance stuff. Seems like there's more higher oxidative stress on the body and how that might show up in the recovery and repair part of the reporting.
Yep, for sure. So there's a exercise and kind of athletic performance part of this too. And in that it tells us
Yeah.
kind of in general how much recovery someone needs. Um, and looks like for you, um, as far as recovery, you're a little bit slower on the recovery side than most people. So we just would probably your total volume throughout the week would probably have a little lower than someone else's who is more on the right side of that bar graph there. Um, yeah, so that's how we would use that. Obviously, just kind of exercise science in itself is important in designing the program, but this is just one more bit of information to plug into that. And so for that too, the slow recovery, if you got to put a lot of volume in, we probably would talk about things that would help that recovery. Like I just mentioned, fish oil and omega-3s, that tends to help muscular performance and recovery and decrease inflammation. So that may be something that we would try to work into the diet more in someone who is a slow recovery in general. We always focus on sleep. It's so critically important. But for someone who's a little bit of a more slow recoverer, sleep would be that much more important that we nail that.
Hmm. I really prioritize my sleep after my adrenal exhaustion. When you're up at 2 in the morning, red flag, staring at the ceiling and can't sleep all night. Once you go through that, it's gotta be your priority. So I always find genetics interesting in how we, like you said, you still need to personalize it, not just go by genetics, but look at what you are doing, what the blood chemistry panel's saying, all the other data you can collect together to, and fitness, the like a VO2 max test, figure out their zones. But I think it's so interesting to look at how you can create more of a personalized program for someone's fitness training schedule based on this data, as well as with the other information, the clues we collect.
Yeah.
But
Yeah.
does it say anything women versus men? That probably doesn't show up in genetics, does it? Or at all?
So no, the genetics itself. Luckily, most people already know their sex, whether they're a man or woman. So
No, I
we
mean like
that's
Stacy
a part of
Sims
it.
for, yeah.
No, I know what
I
you mean. I was
mean, the
like,
high versus low intensity. Women need more sprint training. She always is talking about that we need less long, slow distance, zone 2 and more zone 4, 5 as we get older. It doesn't wouldn't show up here at all.
100%. 100%. And I was obviously joking with that. What I was
I know.
remember that where I was going with it is the fact that we know talking to a man or a woman genetically, that totally comes into play. Like I really love Stacy Sims' book, and now I'm blanking on what
Or
her.
an next
Yeah,
level.
yeah, those are great. And so all our providers usually read those. And so how we design a program for a man or woman is going to be different just because we are different. When we don't get that so much from these genetics exactly, but just knowing that men and women respond differently to different things, we definitely take that into account.
That's why I love adding in metabolism, the exercise tests that I do, because you can see when we do the raw data of people's heart zones and their breathing frequencies and the carb versus fat usage, you can really identify what you're not doing enough of and where you need to improve and put that with this. I think it's pretty fascinating, especially females versus men. I can see more so. And then I was asking Dr. Stacy Sims' team of, when to do metabolic testing and then what do you eat beforehand or not eat, and then test out if I do eat, because she always says you burn more fat for women versus men. And going into the fasted or fed exercise, you can kind of test all that on there. But it'd be, I think, important part to put all this together.
Yeah, and I love that you focus on that a lot. I think any coach that's not taking that into account and is just treating their male and female athletes exactly the same is doing them a disservice. So it is important.
And I think the recovery part, this one's huge because I know I can use intuition, but sometimes you need to see this and then look at your heart rate variability score as you're collecting that data, just more clues we collect to personalize a program. But sometimes high performers and athletes following a training peak schedule or whatever their coach gives them, they don't know that, oh, my performance, if I didn't run for 3 days in a row, actually ran faster and I was stronger. But if I ran day after day, these people doing 5 days of running in a row, they're kind of just uh, getting slower, not faster. So it's good to put this into part of the personalization program.
Yeah, and what I'm really excited about, so we've developed something now. We haven't released it in public yet, but I'm using it, and we will release it to our clients first, probably within the next 2 or 3 months. Is we've taken all of this IP, everything that we have around DNA, genetics, all that, and built it on an LLM or large language model like ChatGPT. So just like right now, you can go to ChatGPT and say, "Hey, make me a program, a 7 day or a
Mm-hmm.
1 month or 6 month training program." We've built this to where I interact with it and say, build me a program, but it takes into account my genetics, my blood work, what my goal is, my HRV recovery. So like I'll have it do a program for me. Recently I was sick, not feeling great, but I really wanted to work out and do something I just need to for my mental health. And so I just asked it, hey, give me something to do for the next several days. It didn't noted my HRV was in the toilet, my resting heart rate was up, my temperature's up a little bit. And so it gave me something to do, but it was something not stressful at all. And it was much smarter than I am, because I would just kind of just crush myself and go anyway. But being able to have all of this on a large language model that you can interact with constantly and ask, like, what should I have for my next meal, or design a 7-day program for me. I'm really excited about that. We'll be releasing that in the near future. And I think that'll be, it's so exciting to me too, because of the cost. You'll be able to get this at
Mhm.
a much lower cost that's affordable for most people when you don't have all the physician and health coaching time built into it.
Yeah. Well, I just wanted to share all this, the report. I'll do a separate podcast, but I think it's interesting how you guys will put the explain as the genetics, what they are, and then you can look at the labs that correlate with that data. The sleep, I mean, I call it the holistic method that I look at their sleep and their stress management, their movement throughout the day, the gut health, digestion, hydration, happiness. Look, all that is important. But looking at I think this would actually be a good solo podcast itself. Just I want to dive into sleep and looking at what you can do to improve sleep and individualize that because as we say, sleep is essential to all the other areas.
Mhm. Yeah, for sure.
That's
Yeah.
great data.
And it just makes a big difference in everything if you optimize the sleep.
So I'll do a separate show, but this is page 20 of 46. So there's a lot of pages you guys would want to go through and get those reports. So how do people get started in the precision medicine program if they want to get this
Sure.
kind of report?
Yeah, everything is just at wildhealth.com. That's where someone could sign up for the program. We also have a podcast, Wild Health Podcast, and a fellowship training program. I think it's all at wildhealth.com as
Mhm.
well. Everything about us and what we're doing is there. And yeah, it's been incredibly fun talking to you, Debbie. Hopefully, um, we'll be able to share some clients. And I'm excited about your upcoming review with our team as well. That sounds
Yeah,
exciting.
I'm in the fellowship program. We are halfway with see it's April, so we go through June. So it's 6-month program. So people can ask me about that. I think it's great information. And for me, that's been like a personal trainer and a coach in athletic triathlon run coach, and then FDN practitioner, and I'm a nutritional therapy practitioner to do this program because I've done all Ben Greenfield stuff. It really helps me kind of put it together, but also I love the behavior coach part of it that we've been diving into because as I've been doing this so long to really turn things around when you have a client to have them take ownership of their own health. I don't tell clients what they need to do. We help figure out, let them be the CEO of their own health and their journey. And I'm just guiding them down that way. So it's pretty exciting to me to go, oh my gosh, that totally makes sense. It's
Yeah,
more
that's good.
effective for sure.
Yeah, awesome.
So I will put all the links in the show notes. We will be doing the True Age Diagnostics podcast and explaining that other test that goes with the Wild Health program. And we'll look out for all the new information coming out from you guys in the next year. So thanks for doing what you're doing.
Thank you. It's great talking to you.